Have you ever wondered how one man could guide a nation through multiple health crises? Let's unravel the story of Anthony S. Fauci. I'm Leah, and I'm feeling excited today. This one has layers, and I'm eager to dig in.
I'm Garrett. I've been looking forward to this, and welcome to Laid Back Learning with Leah and Garrett.
Today we're diving into the life and impact of Anthony S. Fauci.
Quick story. During the COVID-19 pandemic, his name was literally at our dinner table every night. My family would check case counts, then, compare them to what Dr. Fauci said earlier that day. It became this shared routine, a kind of public health weather report. Not gonna lie, it was the first time I felt like a scientist was the most familiar face in the country, besides, the mail carrier. That's pretty cool, right?
So, basics first. Anthony Stephen Fauci is an American physician, scientist, and immunologist. That means he's a medical doctor who studies the immune system and how our bodies fight disease. He spent more than 5 decades at the National Institutes of Health, or NIH, which is the main U.S. government agency that funds and conducts biomedical research. He focused especially on infectious diseases and how the immune system can go off track.
Picture this, a ship in a storm. The ship is public health. The storm is an outbreak, and the captain at the helm making tough calls, steering around reefs and updating the map as the weather shifts. That's how I think of Fauci's role. You want a steady hand who can read the instruments and explain to the crew why they're changing course when the wind flips.
He led the National Institute of Allergy and Infectious Diseases, or NIAID, from 1984 to 2022. NIAID is the NIH institute dedicated to infections, allergies, and immune diseases. And he advised every U.S. president since Ronald Reagan, which is a long span that covers the HIV/AIDS crisis, SARS, H1N1 flu, Ebola, and COVID-19. That's continuity you rarely see. Starting at the beginning, he grew up in Brooklyn over his family's neighborhood pharmacy. His father was a pharmacist who went to Columbia University, and the family worked the counter and delivered prescriptions. That early front-row seat to everyday healthcare seems to have grounded how he thinks about patients and service.
Then you get the student-athlete twist. He captained the basketball team at Regis High School, a tough Jesuit school in Manhattan. Short guy, big leadership signal. From there, he studied classics at the College of the Holy Cross on a pre-med track. Kind of a cool combo, ancient Greek and, biochem flashcards.
He graduated first in his class at Cornell Medical College, then trained in internal medicine, which is adult medicine that spans complex diseases. In 1968, he joined the NIH as a clinical associate at NIAID's Laboratory of Clinical Investigation. That role blended patient care with research.
He rose fast. By 1974, he led a section in that lab, and in 1980, he founded and ran the Laboratory of Immunoregulation. Immunoregulation, in plain terms, is how you dial the immune system up or down so it helps you without hurting you. That lab mapped ways to tame runaway inflammation, which is huge for autoimmune and vasculitic diseases.
Those ideas turned into better treatments. He helped transform outcomes for severe vasculitis, like polyarteritis nodosa and granulomatosis with polyangiitis. These are diseases where blood vessels get inflamed. He even led a redosing strategy with certain cancer drugs that shifted outcomes from near 98% mortality to about 93% remission. That's a wild swing in survival.
In 1984, he becomes NIAID director. That put him on the front line for HIV/AIDS just as the crisis was escalating. Early on, he and activists clashed. Activists were pushing hard for faster access to experimental drugs because people were dying. He later worked with those groups, retooling clinical trial access and compassionate use. Larry Kramer, a leading AIDS activist and playwright, went from fierce critic to calling him a hero among officials. That arc says a lot about listening and changing course.
Meanwhile, his scientific footprint was massive. From 1983 to 2002, he ranked among the most cited scientists in the world, number 13 across all fields. That's the kind of influence that moves textbooks and treatment guidelines, not just journal clubs.
Fast forward to COVID-19. In late January 2020, he joined the White House Coronavirus Task Force under President Donald Trump, who was the U.S. president from 2017 to 2021. At the start, he said the immediate risk to Americans was low, but he added that the situation was evolving. Within weeks, he warned it could become a pandemic, and then the alarms really went off.
His guidance on masking is a textbook example of how evidence and logistics collide. In early March 2020, he said the general public didn't need to wear masks, in part because personal protective equipment, or PPE, for healthcare workers was running short. As data showed asymptomatic spread, people without symptoms transmitting the virus, and supply chains improved, the Centers for Disease Control and Prevention advised public masking in April 2020. He backed that shift. It looked like a flip, but it tracked new evidence.
He also estimated in March 2020 that the infection fatality rate, or IFR, the percent of all infected people who die, could be near 1%, which is roughly 10 times the seasonal flu estimate. That helped justify stronger mitigation. At the same time, public disagreements with President Trump over pace and messaging put him in the spotlight. Some of his TV spots were canceled, and a White House list of his so-called mistakes went to reporters. Context was hotly debated.
There were clashes with other figures, too. For example, Senator Rand Paul, a U.S. senator from Kentucky, challenged him in hearings about masks and comparisons to Sweden. And he criticized the Great Barrington Declaration, which was a statement by some scientists advocating so-called focused protection, meaning shield the most vulnerable while allowing others to resume normal life for herd immunity. He called that unworkable because so many people have underlying conditions and you cannot perfectly isolate risk in real life.
The pressure bled into personal life. He received threats, and his family needed security. In 2021, a big Freedom of Information Act, or FOIA, release of his early 2020 emails fueled both support and criticism. FOIA is the law that lets the public request government records. That period also brought the Delta variant, a more transmissible version of the virus, which led to renewed masking guidance for everyone, even if vaccinated. He backed that change too.
And there were messaging hiccups. A Trump campaign ad used his words as if they praised the administration specifically, and he objected to that, saying it was out of context. He later served as chief medical advisor to President Joe Biden, who took office in 2021, a different administration, but with a similar emphasis on evidence-led messaging. He stepped down from government at the end of 2022 after 54 years, including 38 as NIAID director. In 2023, he joined Georgetown University as a distinguished professor in both the medical school and the public policy school. That's a neat bridge between science and how policy actually gets made.
Legacy-wise, you can't skip PEPFAR. That's the President's Emergency Plan for AIDS Relief, a massive U.S. program launched with President George W. Bush, who served from 2001 to 2009. Fauci helped architect it, and it's credited with saving over 20 million lives, mostly in sub-Saharan Africa. He received the Presidential Medal of Freedom in 2008 for that work. That's one for the memory bank.
He also pushed for biodefense after the 9/11 era. Biodefense means preparing drugs and vaccines for biological threats, and he co-authored calls in 2021 to pursue a universal coronavirus vaccine, a shot designed to work across many coronavirus types. It shows he was thinking beyond the crisis in front of him.
But controversy didn't stop there. In January 2025, President Biden issued him a preemptive pardon, legal protection for potential federal offenses from 2014 to 2025. News outlets like the Associated Press framed it as guarding against politically motivated cases by the incoming administration. Then in February 2025, the Department of Health and Human Services, or HHS, canceled a small NIH museum exhibit contract about him. Different branches, different optics.
In June 2026, Tulsi Gabbard, who was then the Director of National Intelligence, released documents with claims that he manipulated intelligence and lied to Congress. The source material says those claims were false. When subpoenaed to the Senate about COVID-19 in July 2026, he invoked the Fifth Amendment, which is the right against self-incrimination. That's striking for a career scientist, and it shows how legal and political heat can reshape what testimony looks like.
Zooming back to the person, he's married to Christine Grady, a nurse and bioethicist at the NIH. Bioethics is the study of right and wrong in medical research and care. They met caring for a patient and married in 1985, kind of a perfect pairing of science and ethics. He's also lived in the same modest DC house since the 1970s, which is, delightfully normal.
Big picture, his influence stretched from lab insights that tamed deadly vasculitis, to reimagining HIV care and access, to coordinating the nation's response in multiple outbreaks. His work shaped policy at home and saved lives globally through programs like PEPFAR. That's a wide arc for one career. Here's where it gets really interesting. How much of Fauci's story is science, and how much is politics shaping the stage? During COVID-19, some people saw him as a political actor, not because he campaigned, but because public disagreements with a sitting president made him part of a national debate. That perception mattered. Real talk, do you think he stayed nonpartisan, or did the arena change him?
I think he stayed nonpartisan. His North Star looked like evidence. When the data changed, he changed. The mask guidance shift is a case study. Once asymptomatic spread and PPE logistics moved, he pivoted. Also, advising both President Trump and President Biden suggests continuity of service, not team picking. To me, the heat came from the moment, not his motives.
I hear that, but the moment also shaped how people heard him. When a White House distributes a list of your so-called mistakes, or a campaign uses your quote in an ad, you become a political symbol, whether you want to or not. And when he called the Great Barrington Declaration unworkable, supporters of that idea took it as a policy stance, not just scientific critique. So public scrutiny was kind of baked in.
Totally. But scientists have to weigh trade-offs out loud. Focused protection, isolating only the vulnerable, sounds clean on paper, but in a country where many households are intergenerational and essential workers cannot stay home, leakage is inevitable. Saying that out loud is policy relevant, but it's still science-based reasoning. That's the tightrope.
Why did the mask shift feel like whiplash to so many? Was it just the messaging?
Partly messaging, partly timing. Early shortages meant officials had to discourage public buying to protect hospitals. Then science showed people without symptoms were spreading it widely, so community masking made sense. If you don't narrate that logic clearly and often, it feels like flip-flopping instead of updating.
And the FOIA email dump in 2021, thousands of messages from early 2020, let people cherry-pick lines that confirmed whatever they already thought. That's not on him, as much as it's about how complex decision-making looks messy when you freeze-frame it.
For sure, I come back to this. Consistent process matters more than consistent answers when the facts are moving. If the process is measure, test, explain, repeat, it's nonpartisan by design. People may still disagree on the conclusions, but you can at least see the path. On the pop culture side, he became unexpectedly famous. Brad Pitt played him on Saturday Night Live. SNL is a sketch comedy show and got an Emmy nomination for it. There was also a documentary called Fauci from National Geographic that tracked his career and the pressures of the job. Definitely not what I expected for a lab guy.
And for a minute in spring 2020, you could buy donuts with his face on them. Can you believe that's even a thing? It shows how he went from behind the scenes to a cultural icon, which says a lot about how people crave trustworthy guides in uncertain times. Let's try a what if. What if he had accepted the NIH director job earlier in his career? The NIH director runs the whole agency, not just one institute. That's a different kind of megaphone and leverage.
If he'd taken NIH director, centralized authority might have tightened preparedness long before 2020. Think standing vaccine platforms, faster clinical trial networks, and a clearer single voice in emergencies. He was already a builder at NIAID. Scale that agency wide, and you maybe get quicker pivots on stockpiles and surveillance.
I could see that. But there's a trade. As NIAID director, he stayed close to the science trenches. That proximity helped during HIV/AIDS and Ebola, when trial design and community engagement were make or break. As NIH director, he might have been more removed, bigger podium, but less lab-to-bedside contact. Public perception might also have gotten political earlier because the NIH director's spotlight is brighter.
Yeah, that checks out. Also, a single national voice can unify, but it can polarize faster too. Maybe we get cleaner messaging in COVID's first months, or maybe the same fights happen, just louder. Still, imagining faster build-out of vaccine trials and manufacturing capacity under a more centralized NIH is tempting. The time saved could be measured in hospital beds not filled.
Stay curious and keep an eye on the bridge between science and policy. It's where so many health decisions actually take shape.
And take care of each other. Public health works best when we're looking out for the whole crew.